There is low reimbursement in New York, and not only New York, of course, in the whole United States. Very, very few clinics they have managed through their own negotiation with insurances to increase the reimbursement through IPAs, which is a very shy thing. Only few. New York has an IPA, and it's working very, very hard to start building that momentum to negotiate and start working with insurances and get better reimbursements. But no matter what we do, there is always this lack of parity. It is very upsetting, as you all know, when for the same services that you provide, you get the $75, the $85. Whoever gets, the 95, they're very, very lucky, and then you go to a hospital, they get for the same service, for the same amount of time spent with the patient, $250. That's crazy to begin with, and that's something that we need to fight and keep fighting, so parity is where it's supposed to be. So the point here is diagnostics can become a strategic solution. So what's the reality? Decrease in reimbursement, and especially most of us with Health First cutting down 40% of their reimbursement. You can see how that average of 85 can be easily $70 overnight. And that's New York, right? And New York has its high in the expense rate lifestyle, as we know. Cost has increased. Competition, of course, is increasing. Everybody tries to see more people, right? But more volume doesn't mean better business. And we all know that. We all have experience. Through the years, we see ourselves exerting so much effort to see more because we believe the more we see, the better it's going to be financially. But that's a trap, isn't it? All of you have realized that it is a trap. Increased volume, it is a trap. Increased volume means increased expenses, increase liability, and of course, all this effort to find physical therapists. As Dimi said earlier, it's so hard at this point to find physical therapists in the United States. Cut costs, of course, that's a trap. Everybody wants to pay less, and we try to see how we can manage the business with less expenses. Accept lower margins. A lot of people with the Health First, they say, you know what, you're going to take me down to 55, no problem. I'll stay with you. I'll keep seeing the patients for the same amount of time, providing the same awesome treatment for $55. And of course, we become a commodity. That's the worst thing you can do to any field, any profession, any concept, especially physical therapy. Not because I'm a physical therapist, but it is an awesome field to be and utilize to help our community and our clients out there. So what is the shift here? It's to differentiate yourself. It's not competition. It's differentiate yourself. Be somebody else. Because what you've been doing so far, it's what everybody else does. Out of curiosity, just go and look before you go out there. Look at your website and see who created the website, who is the company behind it, the design of it, and then go to your competitors. What are you going to see? If you scroll all the way to the bottom, it's the same company probably, or one of those 4 companies in the whole United States that create the website from all of us. So, and what is including in these websites? It is exactly the same information from one to another. You're not differentiating yourself. And neither you're going to differentiate yourself by including their, let's say, mobilization or whatever technique you use, cupping or not, or laser. Everybody has a laser at this point. Everybody has a laser. How are you going to be able to differentiate? How are you going to really become hard to replace? So the diagnostics provides an advantage. It's beyond treatment. What we're talking about as a philosophy, it's beyond treatment. And it's more of a solving problems. That takes you on top of everybody else. You are the authority. The minute you know how to solve a problem, you become the authority. And people see you as such. What patients want? I am a patient myself. I'm 61, which means I have more need to be out there with doctors and take care of my body and my health, right? However, almost every year we change insurances because we try to find a cheaper one, right? I mean, I'm sure you're doing or you run into the same problem. So you try to find a new insurance. What happened to your primary care? You change your primary care physician almost every year, every other year. So it's like you start from the beginning to navigate the healthcare system, which is so hard, even for us as physical therapists. We're in the business, and it's hard for us to take care of our own kind of health in this system. Imagine our patients. Patients want answers, clarity, certainty. Who is going to give that to them? Not the primary care physician. Nobody does that. Nobody gives answers. Forget about clarity and certainty. No one has time for our patients. But we do. And we do that not because we have more time in our schedule, because by nature, physical therapists care much more for their clients. So we spend more time with them. Diagnostics can be a marketing tool for you because you're going to stop just treating pain and you're going to go to identify the cause of the problem. And this is what patients want to see, want to hear. They want to get that feeling that you are there for them. You want to really give them the answers they want when they are with you right there. Because diagnostics, it's a real time. When you do an electromyography test, you know the results right away. You know the severity of a compromised nerve right in front of you. You know the answer. You can tell them that. When you use MSK ultrasound, exactly the same thing. You can really see their problem. They see their problem, although they don't understand the gray scale of the ultrasound. It's like a miracle. All of a sudden, they feel like more educated, more enlightened, and they feel better right there when they see that you are looking at their problem. It's a low-cost screening. It doesn't cost much to do all these things, okay? You create also diagnostic visits. People will come to you just for a test. So this is how you help to build a better business in a way, okay? Patients see the problem, they trust you more because they do see you spending more time, more resources to really identify what is going on with them. Because most of our patients have been to other therapists and they know what they do, and pretty much everybody does the same thing, but you gonna be doing something totally different. So better adherence, people will follow you, they will follow your orders, higher retention, and just to eliminate that fear, but if I do EMG and ultrasound, I'm going to lose my referrals. That's not true. Physicians, they need you. They need you to have somebody to do their job. Even neurologists will trust you to do the test than send them to another neurologist. Not because they don't trust their ability. The number one problem is that they don't do them on time. In other words, you have doctors, surgeons that will have to operate for a carpal tunnel syndrome, and the EMG is being scheduled 2 months down the road. Neurologists, they don't want to do the test. So there is a huge delay between the request for a test and until it's been administered. So you're going to resolve their problems. So you are a diagnostic partner. Not only that, imagine rheumatologists. Rheumatologists, what they want to see through ultrasound, the advancement or the improvement of rheumatoid arthritis. A rheumatologist is not going to do an ultrasound. They don't have time for that. They don't have the education for that. So they will refer you patients just to monitor their RA symptoms. Very important. So you can triage the patient. And that's where you're called in to really make sure that, oh, there is a rotator cuff tear. You know what? That's more than a centimeter. I have to refer them back to their doctor because that case is for a surgery. Of course, it's not your decision, it's the EMD's decision or the surgeon's, but your knowledge will help the doctor and the patient to make a decision. Reduce unnecessary imaging and send unclear cases. So there is some power here, okay? There is visual proof, case studies, there is before and after. A lot of times you're going to do a test, an EMG test, and after you do a number of sessions, you might have to repeat the test to see the changes there. And of course, you build authority. Business impact, you are positioning yourself in a very high level. Some of you can totally do all these tests as a cash service. It's a hybrid model and it gives, again, higher value. So just to finalize my presentation here, through diagnosis, you can attract better patients, improve conversion, and strengthen referrals, and of course, differentiate your clinic from the rest of your colleagues.